Hi you guys, I'm doing one of my R care videos, and first we're going to start by hooking our suction canister up to our wall outlet right here, and I'm going to turn it on. I'm going to start off with our yanker device. I don't have one, so I'll just pretend. Alright, so we have a sheet that comes over the yanker device, or whatever, that you can pull back to suction your patient out, and you can slide it back over. They do have a blue device that hook up to it, and it's gonna hook up to our suction tubing. Alright, so I do have gloves on, and first we're just gonna suction out the patient's mouth to make sure they don't have any secretions before we do the R care. Alright, so make sure I suction all those secretions out. I don't want to go down too far, causing the patient to gag. Get all in the oral cavity. Alrighty. And make sure I just put this out the way so it won't be in the bed with the patient, so it won't get dirty. Alright, so it's been 2 hours, and we're gonna start off with the suction swab, just actually cleaning the mouth before we brush the teeth. Alright, so like I said, we still have that blue part on there, and all we have to do is just connect it to that. Alright, so I have my solution, and I'm just gonna drench that really well. Alright. And I'm just gonna move the tube over, and I'm gonna make sure I get all down in the oral cavity, in between the gums, at the top of the patient's mouth, and scrub their tongue really well. You don't want to get any bacteria in there. Alright, and the reason why I didn't start suctioning it out, because I'll just do that after. Alright, so we'll suction all that out real well. Alright. And at this point, we'll apply some moisturizer. And the reason why we move this, so we won't cause any sores. Alright. And so I'm gonna put some moisturizer on here. I don't want to leave it in a big clunk, so I'll just wipe it down, and I want to make sure I get good in between those gums at the top and the tongue, and then put some moisturizer on those lips so it can stay moisturized. Alright, so it's been 2 hours. And so I'm gonna throw, because we have a 24-hour kit. Every time I come and do R care, I'll throw this away because we have more. Alright, I'll hook this up to my suction catheter. Put some solution down in there, drench it. Alright, make sure we brush those teeth really well. Get all down in there. You can move this tube to the side. If we need the suction, we can. Alright, and make sure I scrub the tongue really well. Alright. Suction the mouth out. Make sure we don't have any mucus or anything left in there. Alright. I'm gonna take our little swab, put some moisturizer on there. Alright, we're gonna get down in there really good. Put some top of the mouth and on the lips. Alright, once we finish with that, we'll dispose it. Alright, 2 hours later, and I'm back with my catheter. Alright, so I'm going to just hook this up, and I'm going to just pass it along the ET tube, suction all the mucus out, because earlier my patient was sounded kind of wheezy like, so maybe this suction will help really well. And not go on this side. Alright, and you want to stay sterile as possible, even though it's not sterile right now, but you want to try to keep it sterile as much as you can. And that completes everything.